Hey guys, today we're going to talk about some different heart defects. This video in particular talks about atrial septal defect, ventricular septal defect, and you'll learn all about those. The atrial septal defect is also called a patent foramen ovale, so you should all know what the foramen ovale is. It's between the right and left atrium, and it's supposed to close after the baby's born due to blood pressure changes after we cut the cord. However, sometimes it doesn't. And we usually call it patent foramen ovale. Some books call it atrial septal defect, and so you'll see it called both things. You can see this picture has two different pictures. One has it with the heart, and the other one has the box with just different chambers. Look at whatever picture works best for you, but you can see where the arrow is, and that's where the atrial septal defect is. You can see on the slide it says that the atrial septal defect is a left to right shunt. That means that the blood's going to go from the left side of the heart to the right side of the heart. The reason for that being that the blood pressure on the left side of the heart is much higher than that on the right. For example, going into the heart, it's about 3 to 5 centimeters of water pressure. On the left side, it's much higher. So it's going to push it from the left side to the right side and going back, and then it'll go down through that tricuspid valve. A lot of times it does go unnoticed because that pressure on the left pushes it back to the right, and it does still go through the lungs. It still gets oxygenated and whatnot. Sometimes, however, there's so much blood that gets pushed from the left to the right side of the heart that that pressure on the right side actually becomes higher than the left side because there's so much blood being pushed over here. And then we'll have a right to left shunt. So this is a shunt that can actually be left to right or right to left. How do we know? Well, if the baby's cyanotic, it's not going through the lungs, and that would be right to left shunt. If it's left to right, the baby's going to be pink, very pink, because it's going through the lungs not once but twice. Like it says here, most of the time they go unnoticed. They will eventually grow that flap, or that flap will eventually close, depending upon where the atrial septal defect is. Sometimes it's a hole, sometimes it's the flap that needs to close. So eventually, usually those do close, but if they don't, we may have to do surgery. This slide just talks about the location of the atrial septal defect, or patent foramen ovale, PFO, is how that's abbreviated. It could be at the top of the septum. It could be in the middle of the septum. It could be towards the bottom of the septum. It could be one big hole covering the entire septum. Just depends. We'll be able to do an ultrasound on these kiddos if we see some symptoms of left-right shunting and increased pulmonary artery pressures to see exactly where that hole is, or if it's the flap that didn't close. All right, the ventricular septal defect. It's just like the atrial septal defect, only now it's in the lower part of the heart, in the ventricles. Again, it could be one smaller hole at the top, smaller hole at the bottom, smaller hole in the middle, or it could be one large hole taking over the entire septum. It could be left to right shunt, could be right to left. How do we know? Again, if the baby's cyanotic, that would be not going through the lungs. So if you're going from the right to the left without going through the lungs. If they're pink, that would be left to right because it goes through the lungs, then it goes back to the right side, then back to the lungs. Doesn't go out to the body though. But again, just like atrial septal defect, only it's in the ventricles. Two different pictures here. One shows the actual heart anatomy, and the other one's the boxes that show the chambers. Again, whichever picture makes sense to you, use that one. You can see where the arrows are to show you where the blood flow is going. I just want to talk real quick about failure to thrive. I think the rest of this PowerPoint is self-explanatory. Failure to thrive is something that should kind of make you raise your eyebrows when you hear that. That means that the baby is not growing, the baby's not gaining weight, sometimes the baby's losing weight. Failure to thrive could mean many different things. It could mean, again, like this is saying the heart's not functioning correctly. Maybe they have an ASD or a BSD. Maybe they've got blood sugar issues. Maybe they have an infection. Maybe the baby's not getting enough to eat. Could be anything. But whenever you hear failure to thrive, that should be a sign that something's going on. Baby's not growing. We need to figure out what it is. Okay, the atrioventricular canal defect basically means there's a hole in the atrium between the right and left atrium, and the ventricles between the right and left ventricles. So there's a hole at the top, a hole at the bottom. You can see this picture here showing the arrows, the blood just really going back and forth. The slide after this one probably shows a better picture. It's in color and it just shows that blood is just not going anywhere, really. It's just kind of going back and forth. It sounds kind of like a washing machine if you hear it. This baby will for sure need surgery because the blood is not going where it's supposed to. It's just going back and forth, left to right side, left to right side, right to left side, right to left side. And it's not circulating throughout the body like it's supposed to. Like I said, the picture on the next slide shows a better image to show you where the blood's going. We will diagnose this with ultrasound. Here's a key. Every heart defect is diagnosed with ultrasound sonography, and this one will need surgery pretty quickly.